As we indicated in the press release that was issued this morning, yesterday we identified our first presumptive positive case of COVID-19 at our Rideau State Health Laboratories. This was an individual in their 40s who recently returned from a trip to Europe, which included time in Italy, France, and Spain. This individual is being treated in the hospital right now, and our thoughts are certainly with this person and their family to continue towards a full recovery. Beyond that level of information, out of respect for their privacy, there is not much more we're going to release about this individual. And I thank you in advance for respecting that. So I said earlier that this is a presumptive positive. In the past few weeks, Dr. Eva King and her team at the Rideau State Health Laboratories worked to develop the capacity to perform testing for COVID-19 virus. That is the novel coronavirus 2019. In response to an urgent need, the State Health Laboratories expedited the final steps of implementation to run the tests that resulted in identification of this first case of COVID-19. The positive test result here in Rhode Island must also be confirmed by the CDC laboratories, as with every presumptive positive case in the country. What the major task is for us before us now is to continue the extensive contact tracing work that has already begun. That means we will be identifying all the people who could have had direct contact with this patient. This outreach to people in direct contact with this individual has already begun. Fortunately, this person had very limited travel in Rhode Island after returning from Europe. The patient had not returned to work after coming back from their trip. This individual's immediate family members have been self-quarantining at home since it was determined that, based on this person's travel history and symptoms, the individual met criteria to be evaluated for COVID-19. We have been working very closely with them. And at this point, no one else who lived in this person's home has developed any symptoms. That is a critical factor. We have a team of epidemiologists and other public health professionals who are working to contact this individual's additional contacts beyond the household contacts, which is the primary round. These additional contacts are being asked to self-quarantine for a period of 14 days from their last potential exposure to this individual. That means not going to work, not going to school, and staying home. Our team at the Rhode Island Department of Health will be working very closely with each of those individuals, making sure that they have the support they need as they are being asked to monitor themselves for any symptoms during this 14-day time period.